Hello and good afternoon, this is Kuldeep Chaudhary from Health in India. I'm in the chamber of one of the most renowned neurosurgeons in the country, Dr. Sandeep Vaishya, who is currently the Additional Director at the Fortis Memorial Research Institute. This wonderful hospital, which opened its gates to the patients last year in the month of September, had its formal inauguration just a couple of days back. In the last 16 years of his career, out of which 10 years were at All India Institute of Medical Sciences and 6 years at Max Institute in Delhi, Dr. Sandeep Vaishya has emerged as one of the only neurosurgeons in the country who is equally adept at all forms of the surgeries, whether it is brain or spine or radiosurgery or even the brachial plexus surgery. Most of the neurosurgeons specialize in one or the other surgeries, but the results that Dr. Sandeep Vaishya has shown over the last few years has made him a name to be reckoned with in the field of neurosciences in India. Recently, one patient from Siliguri, from the state of West Bengal, inquired from Health in India about the best neurosurgeon for a particular spinal condition. Mr. Mahesh Kumar had a spinal tumor and he was in unbearable pain. His reports were forwarded to Dr. Sandeep Vaishya and his opinion was that the patient required immediate surgery. Since the patient was supposed to come from a far-off place, they planned to get the surgery done in the first week of May, but the pain became so unbearable in spite of all the medications that finally they had to come in the last week of April. The patient landed at Fortis Hospital this Monday morning and was admitted straight away. The surgery was carried out on Tuesday and the patient is ready to be discharged on Friday. It's an absolutely neat and clean surgery. The patient is able to walk just 3 days after the surgery. Is on his feet, the pain is all gone. Let's talk to Dr. Sandeep Vaishya and try to understand about what kind of surgery was this, what could be the complications, and how come patients from all parts of the world, whether it is Iraq, whether it's international patients or Indian patients, who are flocking to Fortis Memorial Research Institute in search of the best quality of treatment in the field of neurosciences. Good afternoon, Dr. Sandeep. Tell us, what exactly was this case? We know it was a spinal tumor, but what kind of tumor, and are these quite frequent in spine?
These are quite frequent. This is a benign tumor. Most likely it would be neurofibroma, but in his case I think it was a glomus jugular tumor, which are very unusual tumors. The problem is that they are very vascular tumors. That's what it made it more challenging, because when neurofibromas are there, you can remove them piecemeal, and so you can keep on making the size of the tumor smaller and smaller, and then you can deliver it through that small opening. But glomus are very, very vascular tumors, so you can't cut them or you can't shrink them. So you have to take them out completely. So that made it much more challenging to take it out completely in toto from that small opening.
So in his case, it's an excision. It's completely
it has
gone.
to be complete.
Okay, and what problems do such tumors cause if they are not operated and removed?
Right. Most of the time the patients present with either weakness or pain in that region. His main problem was severe pain. He was on I think 3-4 painkillers for last 10 days, and yet the pain was not getting better. So.
Because what we've seen, till about 4-5 years back, I don't think spine was being operated so frequently. Today, patients from all over the world are flocking to India for, in search of the best quality as well as the low cost of treatment over here. What are the reasons that suddenly the spine has become such an area where so much advances have taken place?
There are several reasons. Firstly, the MRI was one of the main reasons because of which you could pick up diseases earlier. Secondly, with increasing life expectancy, you can imagine the degenerative disorders which were not there before or which were not being picked up before. Now, you see them more often. As life expectancy increases, you can expect to have more people to have degenerative disorders. people initially were afraid to get operated, but now gradually people have seen that results are good, so it has become an accepted fact. Like initially, say 10 years ago, how many people would go for knee replacement, or say 30 years ago, how many people were getting CABGs done. Now, once people know that the results are good, so they flock for surgery.
And you've done a very fine surgery. The incision is very small, so the recovery developments in the field of instrumentations and techniques.
They have helped a lot.
They've helped quite a lot. So this is all the incision from which you operated, Dr. Sandeep?
Yes. You are going through such a small opening, and
Okay.
then you have to be really adept at that kind of surgery, because your movements have to be very fine. And you can imagine that to remove the tumor from a 1 centimeter opening
You form a formidable team with Dr. Rana Patir. Tell us something about the neurosurgical setup at Fortis Hospital.
See, I'll just tell you about the neurosciences setup, because we are developing a full-fledged neurosciences setup here. So we have got Dr. Dikshit, who is our neuroendovascular person, and he is also from All India Institute, trained from there. And then we are having neurologists, 2 more neurologists are yet to join. And so we'll have a formidable team of neurosurgeon, neurologists and endovascular people. And Dr. Rana Patir is my senior colleague, and we know each other for last almost 20 years. And he's one of the best surgeons in India. And we are not only, our focus is not only on providing the best in healthcare, but also to train younger generation, so that there are more and more people like that. So, patients have to come right now from smaller towns to Delhi for every surgery. So our aim is that these services can be delivered in their hometowns also. So one of the major focus would be on training younger neurosurgeons.
Yeah, obviously, excellent results at the hands of few and at only few centers does not popularize a particular stream. So it's a very noble cause that you've taken up, and trying to develop more centers and more surgeons who perform these procedures. But what methodology, apart from the routine, visiting those towns and giving lectures on and showcasing your cases, do you give them any hands-on experience?
To our juniors, yes. Not only we are taking that in several ways. Firstly, we take their classes regularly. So we have academic sessions on a regular basis. So where we have academic discussions about what is the latest and how best things can be done. Secondly, because many of these younger people come from smaller centers where they have not seen the latest in technology. So they get hands-on experience on these technology. And if they are good, we allow them to help us in surgery. So they learn, and they have a good hands-on experience also. And then we send them for conferences outside, for training abroad if required. So we are developing all-round development for them.
Okay. तो महेश जी, आप सिलीगुड़ी से गुड़गांव तक आए. हमें जरा बताइए, whether in English or Hindi, whichever you're more convenient, how did you feel, how did your search begin?
सर फर्स्ट तो मैं वहाँ पे सिलीगुड़ी में मैं दिखाता था, मोहपाल क्लिनिक है उनके पास, डॉक्टर केसी मोहपाल है, उनको दिखाया तो पेन इतना अधिक था, तो बोले कि हमको एक बताया कि आप फर्स्ट तो आप MRI करा लें. MRI कराया, मैं देन एंड देयर MRI कराया, नेक्स्ट डे में उनको फिर MRI करा के रिपोर्ट लेके विजिट किया उनके पास. फिर उन्होंने बता दिया कि आपको ये ट्यूमर है, अब ये स्पाइन सर्जरी करना पड़ेगा. आप गुड़गांव फोर्टिस अभी न्यू ओपन हुआ है, आप उनसे कांटेक्ट कीजिए. डॉक्टर संदीप वैश्य हैं वहाँ पे, वो आपका नंबर हमको दिए, आप इस नंबर पे लिए और डॉक्टर साहब का भी नंबर दिया. मैंने फर्स्ट डॉक्टर को ना डायरेक्ट कांटेक्ट न करके मैं आपसे डायरेक्ट कांटेक्ट किया. फिर थ्रू मेल जो होने लगा, फिर डिस्कशन हो मेल के थ्रू, फिर डायरेक्ट फोन में, ऐसा करते करते फिर हम लोग, उन्होंने तो लास्ट में हम लोग पहला फर्स्ट था कि हम लोग फर्स्ट वीक ऑफ मे में आना है, बट पेन इतना अधिक हो गया, अनबियरेबल पेन हो गया. तो फिर मैंने देन एंड देयर आपको भी बताया, साहब को भी, डॉक्टर साहब को भी बताया. डॉक्टर साहब कुछ देर मिलता था, उसके बाद फिर मिलता ही नहीं था. फिर पेन से आराम नहीं मिल रहा था, हम खड़ा भी नहीं हो सकते थे. पैर खड़ा होना मतलब बेड पे से उठने के लिए हमको सोचना पड़ता था. अगर बेड पर से उठना है तो हम किसी को हेल्प चाहिए मेरे को. ऐसा मेरे साथ तो ये प्रॉब्लम हो रहा है, पेन इतना अधिक है कि मेरे को चक्कर आ रहा है अभी. तो उन्होंने तुरंत बोला अच्छा ठीक है, आप मेरे को डॉक्टर संदीप वैश्य के केबिन में लाके बैठा दिए. वो बोले क्या पैसा अगर आप यहाँ बैठो. मैं तुरंत डॉक्टर, तो फिर विद इन 10 मिनट
आपका ये अनुभव फोर्टिस अस्पताल के बारे में कैसा?
मेरे को तो सर बहुत अच्छा लगा, क्योंकि अभी मेरा सर्जरी हुआ और जब मैं होश में आया उसके बाद से मेरे को पेन खत्म हो गया. मेरे को माइंड में था कि हो सकता है मतलब सर्जरी में थोड़ा प्रॉब्लम हो, तो पैर हाथ चलाने में या पैरालिसिस का कुछ हो सकता है आंसर है, बट मैं जैसे ही मैं होश में आया तो मैं पैर और उंगली और हाथ का पैर का ये सब चलाने की कोशिश किया, तो बिल्कुल सब फ्रीक्वेंट एज इट इज जैसे चलता है वैसे चल रहा है।
Okay, sir. We hope you all the best in your
बिल्कुल
life.
सर, अभी आप लोगों का कोऑपरेशन बहुत ज़्यादा मिला, आप भी बीच में बहुत हमको हेल्प किए। डायरेक्ट साहब से बात करना उचित नहीं समझता था, इसलिए
We feel very happy to have guided the patient to the correct doctor. We're delighted to see such wonderful surgical results. Let's hope these kinds of results become more and more often.